Welcome. Welcome back after the lunch break. I know this is the difficult part to get going again, so thank you for your attention. Thank you for being here on time. My name is Marcus Guardian. I have been in the past involved a little bit with HTA, and I'm very blessed to be again in the scene a little bit in the background. And it was an absolutely exciting first part of the day, and the discussions really have shown that we, I think, on the right track. There's still a lot to be done, but sort of doing it together and doing it in not only the formal spaces, but the spaces that Dierks and his team have created here is really a blessing. So I enjoy that tremendously. Having heard and seen today, but also yesterday, the ideas and the very valid proposals for KPIs and how to measure success, I was reminded of a project that I had the pleasure to lead many years ago in a very different life. And I had to combine the indicators from a NATO perspective and from a WHO perspective. And I think we came up with about 160 success indicators. And I would have to hire about 4.5 full-time staff to just monitor those indicators. So with that in mind, I think it's a challenge to pick the right ones and to see how we can monitor them. But I think setting those up will be important also to inform us where do we go from here. So thank you for that contribution. I'm very curious about the outcome of our breakout sessions. I'm extremely excited also today to have the expert in the field, Dierks, here to guide us from a legal perspective, and but for a much more competent summary of what we've seen today, I give the word to Bernhard.
Almost nothing to add. Probably after having listened to this morning session, also on the discussion, what we presented, I think if I would have a wish for the breakout session, I think I'd like to focus on what's in common for us and not only to describe the difficulties. I think we'll have lots of time. We had lots of time to discuss difficulties in the past 2 or 3 years. And I think I'd like you to focus on what we can do together to make it a success, not to describe how difficult the world is. Then I can look at the news if I want to see how difficult the world is. But at the current moment, I'm fairly optimistic, as I said before, that we can do that together. And if we look at all the discussion that we have, patients' perspective, health developers, health technology developers' perspective, also the national state perspective, yes, I'm fully aware how difficult it is, and I'm also aware that many countries that have these problems are not present here. But so if we find a common theme for the breakout session, it probably would be to find ways how we can combine the effort that we can do to make it a success. And if it's not successful, then already learned from the administration. We have many reasons to blame everybody else. But at this current status, I think we still have to blame ourselves if it doesn't work. So now we go to the boring part, which is the legislative part. This is only a clinical perspective. Of course, it's never boring if you present it. Dierks, please.
Thank you, the two of you. It's good to see you all again, especially here in Berlin, after we've met in many other cities on many occasions with many topics. And this time we have an entirely different topic. I'm not saying now for something completely different, but when Jörg called me some months ago and said this time it's on how to measure success, I said, what's this about? What is success in a legislative procedure? What is success with an act? And I thought it was maybe he's run out of topics, but then I said to myself, no, actually, this is a very wise idea, because some decades ago, EU legislature was always aligned with impact assessment. Some of you might remember, each of these draft acts had to undergo an impact assessment. And in about every fourth, or maybe even sometimes in a bad year, every third case, the regulators assessed it and said, well, with this, we're just creating bureaucracy and we're not coming up with any effect at all. So we dismissed the law. And somehow this has gotten out of the discipline of the EU, but now we do it retroactively. And my task, as Jörg has assigned it to me, is look into the law and tell us what the legislator intended. Because if we want to measure success, we need a basis in the law, because we might be inclined to measure something that actually is not the purpose of the law, but is just the intention of the observer. And the industry might be inclined to see another intention behind the lawmaking process, as maybe the statutory health insurances. So let us look into what the legislator wrote, because sometimes he is smarter. So as we say, the law sometimes is smarter than the humans that deploy it. And so I want to give you, at first, an overview of what we are dealing with, because things have become, admittedly and expectedly, a bit more complicated than they were some time ago. The aims that most of you would probably, in a multiple choice test, have guessed right is the elimination of duplication of national HTA assessments. It's streamlining market access. Also, here we find the question attached to it, who will have the success and who will have the benefit of this success. And of course, and this has been part of the discussion this morning, the improved patient access to innovation, which sounds fine for one patient, which sounds even better for millions of patients, but which sounds costly for thousands of healthcare insurances. And one of the other aims, of course, is to strengthen EU-wide cooperation and decision-making on this very topic. So as now the regulation is entering into its implementation and application phase, I might add, there is a need to assess whether the intended goals are being met. And so I think you have wisely chosen this topic, and I'm willing to put myself into the service of this project. And the solution that has been discussed is how do we develop key performance indicators that will actually give us an illustration, a documentation, and evidence of the success that we have been seeking with this legislator. And we can derive this from the legislative history that we will find in the recitals in the lawmaking process, which I had the pleasure to participate in. Ansgar, I remember many nights that we were hovering over these papers, and of course the Commission statements. And then we are very likely to find something that we can measure impact with. And I would like to give you an overview, because when I gave this presentation in our office to my colleagues, they say, no, wait, we're totally confused. Which regulation are you talking about? And meanwhile, we have an abundance of regulations. And of course, we have the HTA Act, the 2282 Act, but we have two supporting implementing acts, more to come. And this works in the contextual framework. Sorry, someone trying to call me. In the contextual framework of all that we have seen before on the EMA preparedness regulation, on the centralized marketing authorization, which even dates back to 2004, so it's called EC instead of EU in here, and the other regulations governing MDR and IVDR. And my ambitious game is to show you the evidence for assessing in the legal wording. That's the first column. Then we take a look at the objectives that are behind these legislative wordings, behind the text, and which methods have been established to achieve these objectives. And then I come up with some humble suggestions as how to measure the success of this. Now, as just being physician and lawyer, it's not up to my skills to find the right way to measure this, but I will give you these elements as probably to be applied in a KPI performance measurement scheme. The first headline is Alignment Scientific Assessment for MA and HTA. Now, Jörg and I have spoken about this before, and it's not as much in the focus now as it has been when we started this whole thing in 2005 something. But recital 40 of our beautiful regulation emphasizes the need for harmonized clinical assessments to avoid the duplication of efforts and increase efficiency. Even though in the same recital you will find the wording that the remit should not be intertwined, and the remit should be by the EMA and by HTA, and it should be separated, and it doesn't need to be mixed. But the effort should be reduced, that the evidence supplied is useful for both. And Article 7, of course, being one of the cornerstones of this regulations, requires this cooperation between EMA and HTA bodies for market authorization and pricing negotiations. We also have of the 2699 regulation, the implementation regulation of the Commission, a recital that says the JCA should be conducted in parallel with centralized procedure and in close cooperation with EMA. Now, the objectives of these being quite clear, provide a unified scientific foundation for both procedures, avoid inconsistent evidence requirements, and we've had lots of this in the past, and to facilitate predictable and efficient market entry. There we go. This is another potential KPI where we are in discussion on how to find out how this can best be measured. The methods that are being developed on the basis of this law are the JCAs, of course, is the structured dialogue and the standardized framework. And how can we measure success now? The trigger should be reduction in additional national evidence. And this is something that can be measured because it can be counted. It can be measured faster transition from EMA approval to national pricing. This is something that might not be easy to find out in every country, but with all transparency and transparency on the rise, should be easier in the future. And by measuring the positive feedback from the HTA agency and the industry as well. This being the first KPI, in my opinion. The one that I understood you have been debating on this morning, faster patient access to innovative therapies. And of course, everybody knows the slide with the implementation period for innovative therapies within the EU member states, starting with Germany and 15 days on the one side and culminating in Lithuania with 900 days on the other side. The legislator wants us to create a new slide where these periods are a lot shorter. But every reduction in every one of these columns means euro. And this is something we need to take into account too. And this is why success is such a very ambivalent word if we try to come up with KPIs in that respect. So it's quite clear. Recital 36 clearly points out that improved patient access is one of the goals of this law. That means we need to reduce the time lag and ensure more and equitable access for innovations for the patients within the EU. And the methods deployed to this is the harmonized EU HTA process, of course, the early dialogue, and the fast-track HTA pathways for high-impact therapies, particularly, of course, in oncology and rare diseases. And they've been starting with this in this very year. So our potential KPI measuring factors should be shorter time from EMA approval to reimbursement, the increase in patient uptake for new therapies, and the reduction in disparities between the member states. So much from what I can deduce from the law concerning this second KPI, faster patient access. Then we have stakeholder satisfaction with the EU HTA process. My legal evidence for this lies in recital 20 that stresses the importance of inclusive engagement, recital 29 on transparency, and article 5 that mandates the transparent collaboration process. And we've had many discussions on article 5 in this very EAA for some time. And article 6 requires the CG to report on stakeholder participation and feedback on an annual basis. So this is not just every 5 years, this is really an important goal. Otherwise, this yearly measurement point would not have been set. The objective, of course, is to ensure satisfaction with the process, to build trust among the stakeholders, particularly with the patients, and to promote stakeholder engagement, because if we do not participate, if they do not participate, there will be no success at all. The methods deployed on this is consultations, improvements for accessibility, and the conduction of annual surveys to document this. And my proposal for success measurements are, of course, can we find out what is the annual increase in the number of stakeholders participating in consultation? Of course, we need to assess the limits of the system, because just being a stable number does not necessarily give us any indication about the number of requests. We also need to find out about higher satisfaction ratings from the industry, the patient groups, and the HTA agencies as being the main stakeholders of this quest, and the reduction in formal objections. We've seen that there is a high variation in objecting to the procedures in comparisons within the EU member states. And I'd be very interested to see how this will develop in the near future. Finally, how do we deal with consistency and standardization of HTA methodologies? Recital 25 emphasizes the necessity of common methodologies. Article 1, key article in our regulation, mandates the creation of a harmonized EU-wide approach. And Article 15 requires periodic updates to assessment methodologies whenever required. So the objectives that we are looking at here is ensuring a uniform assessment methodology, reducing inconsistencies, and improving the scientific robustness and the comparability of HTA evaluations. The methods developed are well known to you. As a matter of fact, many of you have been participating in this, developing an EU-wide HTA guideline, outlining the standardized assessment criteria, the clear metrics that have been defined, and the justification that the lawmaker has put as a burden of proof onto the member states if they want to deviate from these standardizations as they've been set on the EU level. So the success management then inevitably brings about that we look at the increase in methodological alignment, that we measure the number of discrepancies in HTA conclusions, and hopefully will observe an increase, a decrease in this, and that we can measure the increase of acceptance of JCA results as a reliable source for national decision-making. So with this, I hope I can have given you some ideas of what the law can support for KPI development, and that I might have contributed a little to the legal foundation of what you are striving for here today. Thank you much. Thank you very much. And my key message is, let us measure.
Thank you. I think this was really great overview on what the legal texts deliver for us in terms of coming to optional KPIs. Nevertheless, I have two questions about it. And one is everything what the lawmaker has said in the context of the law really an objective, or is it maybe partly a mission? And I'm especially asking this because I think some of the promises which the lawmaker has made in the legal text is something they don't have the mandate to guarantee, frankly. So because access is a national issue and remains a national issue, going back to the treaties of Rome, I guess. So probably this is a bit over-promising. I understand why. But maybe this is also the way of political acting to get a foot in the door and then go further. But my question is, can we? I think I'm really tempted as a political subject to see these are all key KPIs, and so I can make it tangible, the success or non-success of the legal process. And if so, this is a political argument. Nevertheless, The
question must be shorter than the answer.
Yeah, and I talked. Yeah, I think I brought my issue across.
Longer.
I brought my issue, and the second one very short now. I think that we want to harmonize, but I think what we see, and this is not addressed here, is that we end up with two-digit numbers of picos, which is the contrast of harmonization, but it's a way around. So maybe this is something which could be addressed. Stop here now.
Thank you for addressing steps 2 and 3 of this exercise, because I was pointing out, where do we have key hints from the legislator as to what can be measured, what can be the underlying definition of success. And the idea behind this is that if we come up with anything else that is outside of we read in the Act, we must justify this, because the legislator has not thought about it. And then we come up with a new idea that is outside of the remit of the law, and that needs to be justified. Still, if we deduce something from the wording of the law, it is up to the others, up to the discussion, to debate this and to say, well, this is in the wording, but really it's not within the responsibility of the EU lawmaker to state something like this. And really this is impractical and we cannot measure this. And then you can come up with all the objectives, and then you can deliver from this a set of really usable KPIs that will be hopefully in agreement with most of the stakeholders. But that is second and third step. So, and in the end, of course, what everybody is striving for is to come up with a scalable number of PICO. Quite certainly. This is one of the very good practical examples of what we are striving for.
First other question. Okay, please.
Thank you for the great outline. You ended up by saying, let us measure. Maybe just to add to that, if you can't measure it, you can't do anything about it. You listed 12 potential KPIs. The one on the methodological alignment across agencies, how do you see, I mean, what is your kind of thinking behind that? Is it kind of towards stricter methodological alignment, or are we looking at perhaps a wider acceptance of indirect treatment comparisons? What would be, how would that KPI be visioned?
I was afraid that you might ask something like this, because this is getting into the nitty-gritty of the details and how to work this out. And of course, we need to establish the scope of potential categories of methodologies with chapters and subchapters and put this into a matrix. And then somebody has to read through all the papers and has to agree on, is there so much deviation that we could say this is not standardized, or is it still similar enough that we might assume that it's similar enough that you can go with one dossier through 2 countries at the same time? So this is really up for the detailed and, of course, very subjective verdicts of those who will be busy on this. And with these 12 KPI suggestions, you will find that some are very easy to measure, some are very difficult, and some might even be impossible.
This is definitely something for the breakout session. I think to be precise on that, it will very much depend on where you start. Further questions, please.
Okay, and sorry. Yeah, didn't see that. HTA is about reimbursability and sustainability, and now you stressed that better access means also more euros. And I wonder, and maybe you can explain, is this an intended or an adverse side effect of the regulation?
Now you're appealing, and she knows me well enough for that, to the heart of my health economic understanding. And I think that every euro spent for health is a good euro. So I think that's my answer to this. And I think any economy that has a high rate of expenditure for health care is blessed. And we see that the life expectancy, and I think this is rather trivial, is very high, where we spend lots of money for health, of course. Not everywhere and not without. There are some exceptions. Jürgen is absolutely right. But I think it's good to spend money on health, but we need to spend it wisely. And this whole system, especially the KPIs, should be designed to adjust this wise expenditures.
I'm not yet convinced, completely understand. The body language, please.
Thank you. Thank you very much. Very insightful. And but I still have a question on the fact that what we want at the end is equal access. Equal access depends on the product of the HTA regulation, the Johnson fee consultations, and the joint clinical assessments. But these assessments are assessments, so they present the scientific parts, the evidence, with its and describe whether there are some methodological weaknesses and some methodological strength, just describing. And then at the end of the process, there is the conclusion that is totally excluded from the scope of the regulation, that is to conclude and make this appraisal phase, giving advice or leading to a decision to take or not to take this new medication and to decide on the price. And this is a judgmental part. This is where you judge whether the scientific aspects, you consider them as relevant and significant. And this since it stays at the national level, you cannot ask the regulations to obtain the same final results because the appraisal part with this judgment remained at the national level. So how can we deal with these aspects when assessing the regulation itself? Because we cannot ask, to go too far in the process because there is the national part that remain national.
I'm not sure, François, thank you for your question, if I understood it well enough to respond logically. Is your question about how much we can deduce from EU law to the application within the member states?
No. We cannot measure the success of a law of something that is not included in the law. So the fact the law makes mandatory to have a joint assessment, it's a big step forward because it will make HTA reports available everywhere in Europe. Currently, it's a good step for equity of access, but it's only a first step. Then the second step is to reach some agreements on the appraisal part, whether we consider that the evidence is significant or not, whether we consider that the methodology is good enough for us to take it on board or not. And so this is key to the final decision on the availability of the product and the time to availability. So
I understand, and I think this is something I addressed in my first slide on the alignment of the results from the assessments on the EU level and the national level. But Thomas, you raised your hand, and I understand you want to translate for my answer, or is this just another question? Okay, I think, François, that is the point which might not have been clear enough in the slides, that we should also measure the variation or the discrepancies between the EU appraisal and the national appraisals. The EU assessment and the national appraisals, to get the wording right.
Would you answer your question first?
Okay, we'll take it bilaterally later. I'm sorry. Thomas.
Christian, thanks for your slides, very inspiring. You're a lawyer, I'm a health economist. So we come from at least partly different worlds in terms of looking at things and regulation. I'm more the pragmatic person. I know lawyers are not always pragmatic when they discuss.
Don't get personal.
No. He's okay with that. He's a grown man. So, but I would just be interested in: do you think this regulation is too much? Is it pragmatic, or is it too much detailed? Too much burdensome? Just your personal opinion.
Just give the mic back. Thank you. Go ahead. Go. Bitte.
My personal opinion is too much, too complicated, but it will depend on people like you and things like EAA to drive a more pragmatic approach in this. I think the idea is great, but what I've observed over the past 20 years has grown into something very complicated, very detailed, very hard to handle, and I'm not sure if the expectations will be met if we not realign on a more simplistic approach. Seeing all the difficulties, of course. Just my personal opinion.
Can we first invite Carol?
Yes, Carol, please answer, ask us your question or say your comment.
Microphone on.
I'm just checking you can hear me?
Yes, fine.
Excellent. I just want to thank you for the most fantastic presentation. It's really helped, certainly in my mind, to be able to understand the potential scope of the performance metrics that are reasonable to include, because I think up until now I've been thinking it's very much about the JCA itself, but in my experience, regulators, so the legislators, absolutely know what they're doing when they put words in a regulation. And so my question for you and for everyone else is to what extent should we be developing metrics that are entirely consistent with the aim of the legislation, even though not all of them are able to be measured through the JCA process itself?
Thanks. I think the question was well understood. Please.
I think I'll come back to the steps that I alluded to before. That I just presented to you the categories in which we can go and shop. And the next exercise will be to find out which of these potential KPIs are really useful to measure. And that depends on the question, of course, of success. And I'm sure that we will come up with many of those KPIs that will not be, not many, but some of them will not be applicable, will not be useful to measure success, but some definitely will. And this is a question of practicability. But as I've pointed out before, we will have a hard time to integrate indicators that are not in the law, as they are out of scope. We need to focus on what is at hand and refine it. And I think this is a very good exercise to have a conference on these indicators as we do have now.
Well, thank you very much. I think we have to stop here. I think that's an excellent introduction to the breakout sessions. Now we could have continued for another half an hour, so we apologize, but Elaine decided that we are not allowed to ask anymore.